Hey folks, it's 6 o'clock in the morning and we're getting ready for our big testing day. So blood work, carotid artery ultrasound, and then heart cath. So stay tuned, we'll give you a report on how things go. All right, have a great day and we'll be back soon. Hey folks, I'm here for my heart cath and they were able to find my carotid arteries with the ultrasound. I've done all my blood work and I had my EKGs. So now we're just waiting for the heart cath. So that's the next step. All right, folks. Well, the big testing day is over. I had my blood work done. I had my carotid artery ultrasound done. And then I just had the left and right heart cath done. And so far, all the results are coming back good. And so it looks very positive for being able to do the mitral valve reconstruction or repair surgery robotically in a couple of weeks. So just wanted to give a quick, report on that. A shout out to my darling bride who's driving me home because I have a right hand that is supposed to be dead. I'm not allowed to use it. Because they went through the radial artery to do the left side, and then further up in the arm, they went through a vein to do the right side. So at any rate, once they pierce that artery, you really do have to take very good care of your hand, and you're not supposed to lift more than 5 pounds for really a week, and just take it very, very easy. And so, yeah, so all of that's done and we're we're about 23 days from surgery. So we'll talk to you soon. So it's Tuesday after big testing day Monday, and just want to give a recap on the day and on how things went. So Monday I had blood test, carotid artery ultrasound, and the cardiac left and right side cardiac cath. And blood work seems to be coming back all fine. We haven't seen the write-up for the carotid artery ultrasound yet, but that seemed to look fine. I didn't really see any sort of obstructions or anything associated with that, but we'll wait for the ultrasound readout. And then finally the cardiac cath. So just to go over what happened to give everybody kind of an idea on how that all worked. Signed in, got my handy dandy wristband plus a bunch of labels, and waited for them to call me back to pre-op prep. Called me back, changed into one of those really awesome hospital gowns. I probably needed to go a size up. This one just seemed to be a little bit on the narrow side for me. And then, they just went through my records, and then they called my wife back to sit with me. They started an IV and pulse ox and blood pressure cuff. And we waited until there was an opening in the surgery. The hospital we were at, if somebody comes in with a heart attack, they're going to bump everybody else behind in the cardiac cath lab, and that's understandable. So we were, a little bit behind schedule, but if somebody's having a heart attack, I'd rather have them go in than me and let them get the life-saving medicine that they need. Cardiac cath, they rolled me in, shifted over to the surgical table, and in the conversation with the folks, I just asked if they talk about putting you in twilight so you're relaxed. I was extremely interested in the whole process. So I really asked them to try to keep me a little bit above, above twilight so I could see what's going on and participate and all that. So they shave. Now, in my case, they're trying to save the arteries and veins in the groin for the heart lung machine, which, you know, can sound kind of scary, but I mean, that's really what has to happen when you're having heart surgery. So grateful that they were able to do that. So they shaved the inside of my wrist and got that area cleaned up. And then they did the left side through the radial artery on my right wrist, and they did the right side through a vein up here underneath the bicep. And that way they preserved the groin for the bigger surgery later on. It was surprisingly quick. I didn't need I didn't need a stent or anything like that. I didn't have any blockages. I had a small 20% blockage of one of the branches of one of my coronary arteries. But I'll talk to my cardiologist about that. I'm not thinking that that's incredibly serious. Certainly is not enough to slow down or stop the coming surgery. So they, on the right side, they take a bunch of different pressures and that kind of stuff and check that side of the heart out. On the left side, they check the arterial flow through the coronary arteries and look at your ejection fraction and those kinds of things. It's really, like I said, it was really quick. They're in and out in hardly any time at all. And then they're patching you up and sending you back to the ward. For the recovery, they put these balloon bandages right over the arterial site because the venous site is under such high pressure, so the venous site will just, it'll self-repair. But they put these balloon type compression bandages over the arterial site. I started to get a small swelling, a small hematoma, so they put a second one in to help compress that. And then it all seemed to chill out at that point. And then they come by after about an hour and they just slowly begin to leak air out of those compression bandages. And over the next hour, they leak all the air out of those compression bandages and see how the site looks. And then you get a lighter duty compression bandage with gauze to put over the site. Now that has to stay here until this afternoon at 4. And then I can take that off, take a shower, and put just a normal Band-Aid over the site. However, because we did go through an artery, then it's really important that I don't stress that arterial site. And so for the next 3 days at least, I'm not supposed to pick up, for all day today, this hand is basically dead. I don't pick up anything with it. In fact, I just hook my thumb into the button on my shirt and walk around Napoleon style. And they told me we could take the splint off, but I feel like keeping it on just helps remind me that I can't use this hand. And it's lightweight and it's not really a pain. So it's just an extra reminder to me to not use this hand. I mean, I can type on the keyboard with it. I can, use my phone, that kind of stuff, but not pick things up and all that. So, so for at least the next 3 days, no lifting anything. Really, they want you to not pick up anything or use anything for 5 days. And after 5 days, then you're back to normal, and you can continue on your way. The other thing that they want you to do, like with most of these, is they want you to keep moving. Like we said in the video on recovery, just keep swimming, just keep moving, Dory. Okay, and that will just help you with your recovery. So that's sort of the synopsis of testing day, I'll call it. And I can't imagine anything from that derailing my surgery coming up in 21 days. So hope you are all well, and God bless.